back again with us. They've done a really fantastic job, and we're always glad to have them back again to feed us and give us therapy. We also have George Mongera with us. George Mongera is from KNH. He's a clinical psychologist from KNH, and it's good to hear from that team. John Gishenga, it's good. I can see you have a pen and notebook in hand. Karibu sana. Dr. Oscar, I'd like to hand this over to you so that you can start off the session.
Okay, thank you. Good afternoon, everyone. Thank you so much, Dr. Kalondu, for that really good introduction. We feel very welcome. I think that as every Thursday has been passing, I know I would be speaking for Purity when I say this. It has been such a pleasure to be able to interact with as many healthcare workers regarding the state of mental health, and as well as you're doing this really difficult job for the country at this time. I think I'd be very happy to ask my colleague Purity to introduce herself first, and then I'll introduce myself, and then I'll take it over from there. Thank you.
Thank you so much, Dr. and also Dr. Kalondu and every other person on board. I wish to welcome all of you on board as we continue finding ways of supporting ourselves during this very stressful season of COVID-19. So I wish to welcome all of you. Let's participate. Let's keep doing this as we together move on. My name is Purity McKenna. I'm a director at Ultimate Care Links, and at the same time, the Deputy Secretary at Kenya Counseling and Psychological Association. It is always a pleasure being here with all of us, and I look forward to a great session. Over to you, Dr. Oscar.
Hey, okay. Thank you so much, Purity, for that introduction. And for those of you who may not know me, my name is Dr. Oscar Githua. I am a forensic psychologist, and I'm also the chair of the Kenya Psychological Association, and I do a lot of consulting work in this country regarding the question of mental health systems, as well as, as forensic mental health. I also happen to be a member of the National Mental Health Task Force appointed by Cabinet in December, and we have a report that will become public very soon because COVID, I think, came and interrupted everybody. But we have a very good document that will speak to Kenyans about the state of mental health in this country, and also we giving recommendations about what must change for all of us to get the care that we require. So today, I'd like to welcome everybody. As my colleague Purity has said, welcome to this session. We're excited to be with you. I can see the numbers growing and growing and growing and growing. That's why I'm delaying starting to get into the material because I know that we are already hitting 900. I'm sure we'll be over 1,000 by the end of this session. It is our privilege today to talk and to start from another point. The point that we had started over the last 2 weeks was the question of managing stress for healthcare workers and what you could do to support yourselves. The buddy system that Purity talks a lot about, how can you be able to really support yourself and your colleagues in the middle of such a stressful time as this. So today we're going to go into a more personal topic that I am sure has affected each and every one of the people on this call, especially if you've already been working in any of the isolation centers, or even as you do your work around this COVID topic. So let me try and project my screen, and I will, as I project my screen, I'll be talking, and you'll see that today we'll be talking about the question of stigma. Stigma in the sense of your own personal stigma, as well as what we call also social stigma. But I will let my colleague talk more about that. But by way of introduction, let me talk about our context a bit. And as I said, we'll talk about stigma today, and then we can move on. As I always say, it's a privilege to be here with you. The team at KNH, you guys are trailblazers. I would like that to be noted and to go into the books of history that when everybody else was not doing a lot of work, you actually stood up and you helped all the healthcare workers in this country to actually get help and to invite people like us to address us and to actually just spend time together. So this is really great. Again, I'd like to thank each and every of the healthcare workers around this country. I know that on this call on Thursdays, it's beginning to feel like a radio show because when you're radio and you're talking, you don't know how many people are listening. However, the crowds have been amazing, and I think that I'm so proud and so humbled at the fact that you've been doing such a hard job under very unusual circumstances. So keep doing it. Keep making our people feel safe, no matter what the political tensions are in this country, no matter anything. The work that you're doing is the most important. So I'll begin by saying that healthcare workers have always faced stigma, and I'll let my colleague talk about stigma and say what stigma is, but I'll talk about stigma, imagining everybody knows what stigma is. But because of the delicate nature of the work that you do, what has happened over time is that every time there's an outbreak of anything, be it Ebola, be it HIV, AIDS, be it SARS, the first one, be it H1N1, be it anything, the people at the front line have always been healthcare workers. And I think that for the first time in this in the world, that do we have an event happening across all countries with none being spared. You've always been at the front line. It doesn't matter what the biochemical challenge has been or the disease disasters. You've always been the first people to be exposed to it. So even as the world has the luxury of reading about it online or even wondering what is COVID, for you, you're living it every day. You're the one who's wearing the PPEs. You're the one who's having to answer the questions about what course will it take. You're the one who has to understand about that microbe. We always say the micron, it's 0.3 microns or 3 microns big, and we really have to understand it. And you're the only one who must understand it, even as you work, even without full understanding of it. For me, while you're heroes on one end, on the other end, you become very vulnerable because of something very unique. Human beings can be thankless, and I can tell you that for free because I know sometimes when you've done some work and then you imagine you'll be patted on the back or you'll be recognized somewhere, then all of a sudden the people who are recognized are very different, or even who have not contributed much. But for you, you actually are in a very vulnerable group for stigma because everybody knows when you wake up in the morning where you're going to go. You're going to a hospital, for example, or a healthcare facility, and most likely you might come into contact with somebody who might be infectious or might have something that is actually, terribly infectious. In this case, of course, COVID-19. On the funny thing about human nature also is that on one hand we can clap for you on Wednesdays. I keep talking about that. We clap for you to recognize you, but on the other hand we are refusing to pay you salaries, and then on the other hand we are also refusing to recognize you. And when we see you, we cross the road and start talking on the other side. Why? Because we imagine you might have coronavirus and you're going to infect us. So what is happening is that you are going to become what I will call the lonely hero. Okay, the lonely hero, the hero who everybody talks about, but then also when they are with you, they're actually almost avoiding you. So today we will actually explore this very unique experience that you've been going through, and hopefully please share with us about your experiences, because we want to actually be able to make a difference in your life. I think that it is by way of you sharing what you're going through, because you're the ones on the front line, that we can actually be able to talk to policymakers and actually tell them these unique anecdotes from your experience. And once we do that, something can even be shared nationally. So we won't only hear about numbers, neither will we only hear about which place is a hotspot, but we will also hear the appeal that the people who are working with the men and women who are on the front line to reduce the way they interact in a negative way with you by way of increasing your stigma. So one of the things I can say is, by way of introduction, is that social stigma is this negative association between a particular type of people or group of people and a certain disease. So right now, we are saying that there is stigma that is extending. When you call a place a hotspot, in fact, we've been really wondering about the people who are doing communication and saying, okay, fine, now that you've said that Isili was a hotspot, or you say that Old Town Mombasa is a hotspot, or you say that Kawangware is a hotspot, what are you doing to people from Kawangware? What are you doing to people from Kawangware? And even more importantly for me, what are you doing about what are you doing about people who are in the healthcare facilities, especially the nurses, the doctors, the lab techs, everybody who is in those facilities. And even when you say that Kenyatta is one of the isolation centers, Mbagathi, KU Hospital, now we start saying that the people who work there are actually targeted. So this might actually mean a few things. That number one, you're going to be labeled as the person who is infected. You might be stereotyped. You might be discriminated against. You might find a place where you're not being served even because they think that you need to isolate yourself or whatever. You might actually be treated separately or even experience loss of status because of the way people imagine that you're infected. So instead of the respect that you've always had as a healthcare worker, there's a new phenomenon that is now happening that now exposes you to being treated differently. And this actually is really a negative feeling. And I don't think that a lot of people have been paying attention to how you're feeling and the things you're going through. I know that even families, and I know we'll hear a lot of examples about in the family setting, when you go back home, you have to isolate yourself. I remember last week or the week before, we were talking to a group of people who also are working, your colleagues. And one was saying that when she comes home, she can't even stay in the same room with her family members. She has to go to a different room. And of course, she's doing that because she's responsible. But why not for the fact that her family is so understanding? You can imagine what people might be thinking. Oh, ni kwa sababu anajua akona COVID, ndio maana anajitenga kwa sababu akona huu ugonjwa na atatupatia, And so even family members might even start talking badly to your spouse and saying, ati mko kwa hiyo nyumba moja? Hapana, toeni hao watoto huko, mnawa expose, things that don't even make sense without them realizing that you really take the highest care and also that you employ the highest levels of biosecurity to be able to do your work. They don't understand that about your training. Also, you're not the only people who are actually going to be stigmatized during this time. There's also the caregivers of people who might actually be infected. Families and friends and communities, as I said, the communities like now which have been called hotspots. Now people are looking at people with suspicion and wondering, what are these people doing, and what are they doing, and could they be the carriers? And I can even give you a story that I know. I know people who hire domestic workers, especially from the area of Kawangware. What has happened is actually pretty negative. Ever since it started being called a hotspot, a lot of these people have actually lost their jobs. And they have lost their jobs because they are being told and they're being seen as the people who are carrying the virus. And you can imagine, for somebody whose income already was not that much, to now be crucified, so to speak, for just coming from a certain locality, geolocation, that is really unfair. And you can imagine now they're losing their income, and now coronavirus is becoming a story about economic distress, even more than the actual virus itself. In fact, nobody cares about the numbers anymore. Apparently now, it's biting us in our pockets, it's biting us in the way we are treating each other. And in fact, it's really making us not like each other for no reason. So if you really look at it, that actually might be the way people are suffering from stigma. Also, we are finding that people of certain backgrounds are being discriminated against. I remember when it started and then the flights had not been stopped. I remember that the word on the street nowadays is saying, huu ni ugonjwa wa matajiri, ni matajiri wanatembeanga na ndege. Kwa hivyo hawa sasa ndio watu wenye watakuja kutupatia hii corona, mbona hawakufunga hizo airport, au ndio wametuletea. And then now, nobody is also looking at the truck drivers who are crossing from any country next to us. Nobody is looking at all of that. But then even, why would we be looking at people who have an illness and a disease in that way? Now it has become that everybody who has come in contact with the virus or comes from a certain social group should be avoided and should be discriminated against because they most likely will be carrying that virus. That is really bringing a lot of distress to people, even as we speak. Why is it causing so much stigma? There are three reasons why we are seeing that COVID might be bringing this stigma, and of course I'm going to allow Purity during her time to present. I'm sure she will mention it deeply and talk about what she'll really talk about what stigma is and go really deep into self and social stigma. But there are three levels to which, the three factors. The first one is that it's new. It's a new disease. That's why it's called the novel coronavirus. And so there are a lot of unknowns about it. We now have so many myths around it. We know that in Madagascar, we have that mitishamba cure. We also have the president of the United States talking about hydrochloroquine. We have people talking left, right, and center about what is going to, even dawa. And I cannot believe the amount of forwards on WhatsApp that I've gotten, which actually talk about the kind of cures you can get in your house. Lemons. Other people are saying you can drink methanol and ethanol. Can you imagine drinking ethanol? I mean, anyway, maybe we didn't do too well in chemistry as lay people, but I can assure you that healthcare workers know that that's not the truth. Also, that human beings are normally afraid of the unknown. And so let us not forget that this is a reaction that is normal as human beings. People don't know what it is about. So in the same way that in the early 1980s and the late 80s, when anybody said HIV, they associated it only with people who are either homosexual in their choices, or they were associating it only with a certain moral behavior, or they were talking about that it only was in certain parts of the world and not the rest. So when people are afraid, they often resort into promoting stigma. Also, the third point, it's very easy in the middle of this stigma for someone to actually form what I call in-groups and out-groups. In psychology, we normally say, and you can see this happening in Kenya all the time, Kenyans love each other for 4 years. We love each other for 4 years. We live with each other. We marry each other. We have children with each other. We live together. And then when it comes to around the time for elections, all of a sudden people form an in-group and an out-group. And the problem with that is that you find that the out-group becomes an enemy that must be defeated at all costs. And when I say that, I mean that this enemy must be crushed at whatever level. So as they're trying to crush the enemy, in this case, especially with COVID, they're talking about, it's about discrimination, it's about stereotyping, it's about saying I'm better than them. Even I've heard people say, Africans started by saying, no, our DNA does not allow us to get COVID. That's also another way of associating fear with other people. And people even started almost wishing bad things to the Europeans and Americans. As you can imagine, all of those people that have died in the Western world also are someone's mother, someone's father, someone's sister, someone's brother and child. And you can imagine that the pain that they're going through is not different from the kind of pain we would go through if that was to happen to us as well. So one of the things about stigma is when you start seeing people becoming irrational in how they ascribe pain, and the way they start pointing fingers at other people. They say, unaona wazungu ni Mungu sasa amekuja kuwachapa kiboko kwa sababu walikuja wakakuwa colonialists. I think that stigma has any example of people make examples and excuses for it. And so they go either to religion or they go to other explanations that might not be fair if you really think about it. But therefore, it is understandable that there's confusion, a lot of anxiety and fear amongst the public. And in fact, to make matters worse, right now in our country, because of the way we are as people, sometimes we're even saying that COVID does not exist. Ni njama ya serikali kupata nini? Kupata pesa. So you find that there are people who are now even talking about those kind of myths, okay? Unfortunately, all of these factors that we're talking about are fueling very harmful stereotypes that might harm us. By way of conclusion, what will I say? Your work is priceless. I'm going to allow Purity to start getting ready now. But your work is priceless. And I'm going to say this every week that you'll hear me speak with you. I will say it is priceless. And nobody else can actually thank you enough. So when we have the chance, we humbly just say thank you so much for the work that you've done. We have a team, of course, and we've been coordinating with the team from KNH to see that you're helped. We've been running really good sessions for the last 3 weeks, and I'm so proud to be associated with this effort. Keep it up, keep it up. And as I say, when all is said and done, after we have removed 2020 from our books, you will be the ones in the history books that the healthcare workers of this world, and especially of this country, were the ones who are the heroes of this pandemic. So thank you so much for this opportunity. I'll be on standby as well as when we have the Q&A and discussion session. Thank you so much. Thank you.
Okay. Thank you so much, Dr. Oscar, for that great foundation to this subject today. I really appreciate your input. I know we've learned quite a lot and we are moving on with the learning. I want to also acknowledge the fact that the season that we are living in right now, the COVID-19 season, is a challenge to so many of us. It's a challenge to the health care workers. It's a challenge to the patients. It is a challenge to literally everyone around. And so even as we talk about stigma, yes, we are referring to stigma meted to healthcare workers, but at the same time, we can't forget that our families too are being stigmatized. Our children are being stigmatized. The patients are being stigmatized. And these are things we need to have at the back of our minds. Anytime I do a meeting like this, I want to ask myself, am I stigmatized or am I stigmatizing? Because at the end of the day, I am doing one of them. So the question is, am I the stigmatizer or am I the stigmatized? So even as we continue, it's important that you ask yourself, which side of the divide are you? Or you could also be on both. And it's important that we ask ourselves this question so that we know exactly what kind of support do we need? What do we need to change in our lives? And so even as I say this, I had a very interesting scenario about an hour ago. I was driving near KU Hospital about an hour ago before I came to sit for this meeting. And something very interesting that actually, there was this ambulance that was bringing a patient to the hospital. And there are bumps there. Of course, those who have used that road, you know, there are some bumps that have been put there. And so there was a bit of traffic for some reason. So the vehicles had slowed down and the ambulance comes and the siren and all that. And so when people started moving to allow this ambulance to pass, I heard the people who were standing at the stage. There is a stage there. There is like a small shelter that has been done there. The people started saying, hao ni watu wa corona. You know, like it's something really bad, and they were like, unaona hata hao madaktari wamekaa hapo mbele, hao ni watu wa corona. And that left me thinking about these doctors or whoever it is that was in that ambulance, and the window was down, and so they are hearing what people are saying because the traffic is slowing. And actually there was a pickup that was carrying some building materials, and some people were up there, and they started saying, actually addressing the doctors and saying, nyinyi ni watu wa corona, sijui kama mnatusikia juu mmejifunikanisha. You know, I felt like parking and calling these people aside and beginning a meeting there and then to just help address issues of stigma. It left me thinking, and I said, indeed, there is stigma everywhere that we go as healthcare workers. We are stigmatized on the roads, we are stigmatized in the hospital, we are stigmatized at home. So where do we turn to as healthcare workers? The other day, I did something at Kenya Red Cross, and people, of course, I was doing some TV show, creating awareness and all that about psychosocial support. And after that, on my way home, I received some very interesting message from some people at home, and they were like, so Purity, umekuwa hata wewe ni mtu wa corona. I actually like felt these people cannot understand these things. And now this is where we all are. So that was just supposed to just let us know that personally, like Dr. Oscar is saying, I feel you. I feel every healthcare worker, because it is not easy. The work is not easy, number one. There is no support. If it is there, it is very minimal. Then the environment that we are living in is also not supportive at all. There is stigma right, left, and center. And so this leaves me to wanting to share my screen with us. And I want us to see this. You realize I love using images a lot because they allow people room to think They allow people room to want to understand what is happening. Just a moment, I give you full screen. In a minute. Okay, there we go. I want to start there. What can we see on that very screen? You could just type your comment on the chat box. You could just take a moment to reflect and imagine what could be happening to these people. And imagine which side you're standing. Are you on the white or on the side of the blue? As a healthcare worker, where do you find yourself during this season? Let's go at home. When you find yourself at home, maybe with some people in the estates where you're living, maybe meeting up with friends, where is your mind as far as response to COVID-19 is concerned? Is it on the blue or on the white? Is your mind telling you, hawa watu wananiona mimi ni yule jamaa wa corona, you know? Because it doesn't have to be necessarily people saying it verbally. It could be happening in your mind. When you're working at the hospital or wherever it is that you're placed, the colleagues that you're working with, and maybe they're not directly responding to COVID-19, where do you imagine they place you? And where do you place yourself where they are concerned? I think this is an image that we can all try to identify with. I'm trying to see what has been put on the chart because it is important for us to get it. Now, when we look at that image, we go to this next one. Disconnected. I'm just giving you some seconds to try and see whether you can relate to that image. I don't know what comes to your mind when you look at this one. Okay, after you have seen this, I want to take us back to what Dr. Oscar had mentioned earlier on about, he had mentioned about stigma, which is social and self. And so I want us to look at that so that we know exactly where we are as far as stigma during this season is concerned. Are we self-stigmatizing or socially stigmatized? What do we mean when we talk about social stigma? I know that Kari had mentioned a few points about it, but simply it's that negative association between a person or a group of people who share certain characteristics. And Daktari put it so clearly. He said that this comes with labeling, it comes with stereotyping, it comes with discrimination, people's being treated separately, and of course, a loss of status. And I don't know about us today as healthcare workers. Do we feel like we are being negatively associated with COVID-19? Yes, of course. Going by the example that I saw today at KU Hospital, I believe totally we are being socially stigmatized. When someone stands, an adult, and actually looks at the other person who is helping someone who is in need, forgetting that actually I could be the one in that ambulance. And they are saying, ndio hao watu wa corona hata sijui kama wanatusikia, you know, something like that. Yeah, being associated with what is happening. And of course, the labeling and all that, the stereotypes, I don't even want to go to that. When we talk about self-stigma, this is where a person, the stigmatized person, internalizes perceived prejudices and develops a negative feeling about them. So someone here has labeled you mtu wa corona, and now you come, internalize that, and indeed you realize ni kama hata umeonewa. You know, the way we just look at it and we're like, we were treated unfairly for us to be working or supporting patients that are COVID-19 positive. You feel like you were picked unrightfully. And you ask yourself, why is it that I'm the one who was placed in charge of this and not so and so? Is it that they thought I'm the one who deserves to die? And because obviously everybody is thinking about COVID, and especially at the beginning, when we all began talking about COVID-19 and all this, we thought now again it's a death sentence. And so you imagine you are the one who is supposed to die. These others should live and continue enjoying their lives and working and what have you. So you stigmatize yourself by perceiving and internalizing what others have said or what you have read or what you think. So you stigmatize yourself. And so when we look at the image that the last image I gave us, you see that lady who has, okay, somebody said who has fatigue, but when you clearly look at it in relation to stigma, it is either she has been isolated by the others who are standing somewhere there. And okay, let me take you to that image so that you get what I'm talking about. You see, it's like she is isolated. She may have isolated herself, or she may have been isolated as a result of whatever is happening there with the three that are standing there. I don't want to make a conclusion, but I'm saying sometimes out of our own perceptions, we isolate ourselves, we stigmatize ourselves. When we get to this one, you'll see how this person feels, the person in blue, as a result of stigma. There are many things that we can say about this. These people in white, when they look at this person in blue, I want to tell you this person feels like the world is crumbling on them. The head is heavy. You can see he's just there, so helpless, feeling like the world has ended for him. Stigma is really bad. And I know that if any one of us here is going through any form of stigma, be it self-stigma, be it social stigma, there is something that we can do about it. There is something that we can do for us to be able to get over it. So I don't want to go to that because the Carrie had already mentioned, but I want to look at the impact of stigma. What's the impact of stigma? When we are stigmatized, when we stigmatize, what happens? Especially as healthcare workers, when we are stigmatized, our quality of service is lowered by all means. You are not able to give your best because you're drained, emotionally drained, physically drained, psychologically drained. You have no motivation because of stigma. Then again, stigma impacts on relationships in a big way. So for example, you're working in an hospital and there are other colleagues who are working with you but in different departments. Maybe they're not responding to COVID-19. How do they look at you? How do you look at them? Relationships will be affected. I know I was actually talking to someone, I've been supporting someone who is actually almost separating with the family because of COVID-19, having to work in the hospital and supporting COVID-19 patients. I mean, it's just so bad. Unfortunately, not many people want to come out, especially healthcare workers, and share what they are going through. But I want to encourage us, do not die quietly. Do not get depressed quietly, you can talk to someone, you can be helped, your hand can be held, and you get the support that you need. So COVID is affecting relationships in a big way, both at the family level, both at the work level, and so many other social angles of people. Then also, you will realize that stigma impacts a lot on social cohesion and prompts possible social isolation, just like we have seen on the previous slides, the images that I have given us. Then again, it drives people to hide the illness to avoid discrimination. So people who are probably unwell, like today, if you caught a cold, if you had this flu, would you even imagine that you want to go to the hospital? Would you even want to tell someone that I'm down with a cold? By the way, before I used to hear even my friends telling me, hey, Purity, I'm down with a cold. But since COVID, no one has told me they're down with a cold. I don't know whether cold stopped. I don't know. I'm just saying. But these are the things that are happening. People get unwell and they don't want to go to the hospital. The other day, I visited this particular hospital taking my son, and right from the door, I was so shocked that right from the door, someone is asking you so many questions that are so stigmatizing, you don't feel like you want to continue getting into that hospital. Of course, I understand of being a healthcare worker. I understand. How about someone who cannot understand where those questions are leading? Stigma is all over the place. And so people are not uptaking other medical care that they need to uptake. Then again, stigma, of course, prevents people from seeking healthcare immediately. I have mentioned that, and also discourages them from adopting healthy behaviors. This is very critical. Stigma would make people discouraged to adopt healthy behaviors. They don't care anymore. They become lethargic, and apathy just comes on board, and they don't want to do what they need to do for them to be able to move on. So then what happens to groups that are stigmatized? This Daktari brought it out clearly. I don't want to dwell on it. But now, how do we manage stigma? How do we manage this? How do we manage discrimination? Number one is we need to avoid stereotypes. The moment we start saying in ugonjwa ya matajiri, you have literally like messed it up. You know, I'm not saying you, but this is the kind of information we need to even pass to our family members. Remember, we keep saying that the information that we get here, we need to share it out there with our families. We need to share it even in our other places of meeting with people, even with colleagues who are not able to join. So we need at all costs to avoid stereotypes. Do not be the one saying, in ugonjwa ya wachinku, you know, like everyone is saying, ugonjwa ya wa China, ugonjwa ya matajiri. The moment we do that, then people become careless because they will not take care of themselves. They will not take the precautions they need to take because they feel this is not, it cannot affect us. It is for those ones. We are excluded. Then again, remember not to isolate yourself. Neither should you isolate the other person. How do you do this? One thing I keep saying is, the moment you realize that you don't have control over what the other people will say about you, you only have control over what you say, think, or do, then nothing will bother you. You will stop being bothered by anything. Even stigma will not be found in your vocabulary because you won't care much what people will say. You care much what you think. Remember, stigma, especially self-stigma, is as a result of a perception. And perceptions come when we allow what everybody else is saying to take a toll on us. So remember, what you cannot control is what somebody will say about you think about you or do to you, but you are in control of what you think after they have said what they have said. You are in control of what you do after they have done what they have done or said what they have said. So you need not to isolate yourself. You need not to also isolate your colleagues. So that is very, very important in managing stigma. Then the other thing is, don't let stigma create self-doubt and shame. Don't let stigma create self-doubt and shame. And this is a very, very important point. I know there are healthcare workers who have been feeling like they are so hopeless, so helpless, because they actually, one told me one day, I'm working because really I need this money at the end of the day. I need to pay my bills. Otherwise, I would resign. I would just forget about this thing. And when I explored further, the reason they felt that way is not because they are healthcare workers, but because they were chosen to work in them to support the COVID-19 patients. Another healthcare worker working in the supporting the people who are under quarantine told me, Purity, I came here today actually dragging my feet, and I feel like I don't want ever to come back here. And I understand totally, because it is overwhelming. You feel like you are cast to die. I want to tell somebody this afternoon, do not let stigma bring self-doubt on your calling, on your work, your profession, on your career. Do not allow stigma to do that. If you know completely you're supposed to be serving people the way you have been doing it, do not allow stigma to get into you and bring self-doubt. There's somebody who says, I doubt. Actually, somebody told me they want now to be counselors. They want to quit, let me not mention, but he's a healthcare worker. He wants to quit that and start doing counseling, because counseling you can do at home, but injecting and all that you can't do at home. So I said, well, these are reactions, normal feelings, because the situation we are dealing with is really abnormal. Another very important thing in managing stigma is having a person-centered language instead of the condition-centered language. What do I mean by this? When you have a person-centered language is, I will refer to someone as a doctor, as a nurse, as a so-and-so, and not as a COVID person, this corona person, that corona doctor, that, like everyone looks at CS Mutai. Everyone looks at him as the COVID person, and even children in our homes and everything, wanasemanga ndio huyo mtu wa corona amekuja. So instead of referring to him as he is, we are identifying him with COVID. So it is important that we start adopting a person-centered language. Like in the hospitals where we are, instead of saying, niko huku kwa corona, just say the ward that you are in. Say the place where you are, not huku kwa corona. Because at the end of the day, somebody who is listening to you, if the person that you are talking to is also responding to COVID, I mean, that person will be really devastated. Just by a simple statement that you have made, we need to be sensitive. Basically, person-centered language is a sensitive language, which is mindful of other people's feelings. Then, the other thing is, treat everyone with dignity and respect. You're working with people, let's say patients. Remember we said even the patients are going through stigma, a lot of it. And I know sometimes you don't even feel like you want to get close to them. You just have to, because it is work and you really need to support them. Otherwise you wouldn't. Let us treat everybody with the dignity that they deserve, with the respect that they deserve. deserve. As colleagues, let's support one another, respect one another. When we are talking to people, let's remind them to dignify everyone just as they deserve, to respect everybody instead of looking at them with a COVID-19 eye. Then also share your experiences as a healthcare worker. Do not keep your experiences to yourself. Some I know are very painful experiences. I have listened to healthcare workers, and honestly, like nurses and doctors, and yesterday I talked to one lab technologist, and some of the things I've been hearing, honestly speaking, they're so heartbreaking, and that person needs somebody to listen to them. They need somebody to support them, somebody to tell them that they can make it even the day, the tomorrow and the day after. And we need to be able to share our experiences. I want to encourage all of us who are listening to me this afternoon to be at a place where we can open up and talk about our experiences, not to just for the sake of opening up, but let's talk to people who can understand. Let's talk to people who can hear our pain, the people who can understand us, and these are professionals. If you just start talking to family, this is another issue altogether. Talking to family about your experiences, trust me, they will run and leave you alone, or you will run and leave them. So it depends. But what I'm simply saying, share with people that can be able to offer you support. You could talk to a therapist, a counselor, you could talk to a psychologist, you could talk to your colleagues, and you will get the support you need. This is also very important, having your facts with you, facts about COVID-19. And by the way, this is information that goes beyond COVID. We can talk about HIV, we can talk about cancer, we can talk about any other disease or condition that is stigmatized. So have your facts right. And especially this period of COVID, remember to have your facts right, because even when you go home, you are talking to your family members. Some of the information they have, what we have out here as lay people, actually, it is so misinformed, very, very misinformed. We need to have the facts right to put them across. When somebody is stigmatizing you as a result of a stereotype, with a stereotype, you need to have your facts right and put them on the board, and everybody will be able to get to understand these things. Then finally, and of course, there is so much more that we can do. It is important for us to seek counseling support. The moment you realize the things that we said last week, but one are happening to you, you are having nightmares, you are having sleepless nights, you are overeating, you are overdoing everything, you are over drinking, over smoking, all these things, and you're feeling completely overwhelmed, you are lethargic to so many things, you have developed apathy, all these things as a result of the kind of work that you're doing. It is important that you seek for counseling support. Thank you so much. I want to appreciate each one of you for listening. And like Dr. said, we sincerely feel every one of us, because we know we have put our lives in so much danger, so much risk, to be able to support our people, to be able to support the people that we are supporting on a daily basis. We acknowledge your efforts. We honestly acknowledge. If nobody else tells you this, then myself and Dr. Oscar, we appreciate what you're doing. Thank you very much. Over to you, Dr. Kalondu.
Thank you so much, Purity and Dr. Gidua, for that wonderful presentation. And thank you for always appreciating us. We don't take that for granted. Most times, the healthcare worker is not appreciated as much, and we appreciate when people appreciate the work that people have done and what they've seen. So thank you so much for that. I'd like to give George Mongera an opportunity to share something with us before we let Dr. Nancy Ngumbao take over the Q&A session. George, hello. George? Okay. As we give George Mongera a chance to unmute himself and join us in this conversation. Purity, there's quite some feedback about the first picture you showed us.
Yeah.
And somebody, the first and the second one, somebody saying they're seeing emotional fatigue, they're seeing a stressed healthcare worker. The female is away from the three, has been and is feeling separated. In the Q&A section, there's a bit of sentiment about that. Somebody's talking about low self-esteem. They're also noticing that the person is feeling left out.
Mm-hmm.
And they're noticing that this is a solitary soul.
Yeah.
And most of them are saying, okay, a few of them are saying they associate more with the person in blue. You remember the diagram where there was a blue person and there was a white?
Yeah.
Yes, so most of them are saying they are associating more with a blue person. Mary is saying there are men in white and a lonely man in blue. So somebody saying the feeling that they get from that is that it's a sad situation. So there's quite a lot of feedback concerning the diagram. And as you've said, images are a powerful way of expressing oneself.
Yeah.
So yes, and thank you for that. Let me still look for George. You give him an opportunity. Yes, George, how are you?
Yeah, I'm fine, thank you.
Yes, you can take over and say something.
Okay, thank you for the opportunity. Sorry for, I'm learning also up and down, just because of the same case issues that we are talking about, stigma reduction. In the course of the meeting, I've received several calls that we are supposed to attend to our staff who has been exposed in different wards in the hospital. And it's like we are fighting fire every other moment. And this is some also the reaction we need also to understand. There is a lot of panic and fear among healthcare workers because of this disease. And one of it is just, the panic. And sometimes, although our healthcare workers have the information about COVID and even the way of transmission, yet still there's panic when a patient is identified or diagnosed to be COVID-19 positive. So it calls for a lot of maybe sensitization. Like now we have received 2 distress calls from various wards. They are panicking. Yet we are the people who have been handling these cases, even more worse cases. But because of the stigma that has come with the COVID-19 epidemic, people are really reacting probably in that state. I understand where they're coming from. So these are the challenges that we have even in an hospital like this, despite us being healthcare workers who have been exposed to various even worse conditions, yet we are panicking. What we need is, once we have the required protective gears that we are supposed to work with when you're in the ward and taking the necessary precaution, there's no need for alarm, even when we have a patient who have tested positive. But this is an indication of what is happening among the healthcare workers. The other thing is the reaction of healthcare workers towards the patient who have been identified or diagnosed with COVID-19. The way we are reacting towards the patient, sometimes also it leaves the patient to feel like they are stigmatized. So, and which is not really good for us. So I think the thing is, we will continue like us now. We are doing some sensitization among the healthcare workers, among our colleagues, so that one, they avoid the stigma and also self-stigma also, because some of them, I've talked to some of them, they're even dreading going home, back home to their family, because they feel like they'll be exposing their family members to the virus, whereas they have taken the necessary precaution, which that they should also be, comfortable, not very comfortable, but they should be assured, yes, I've taken the necessary precautions, and then there's no need of panic. But this is what we are doing. We are trying to sensitize our colleagues on the same. And this is a good forum so that people are aware, especially the health care workers, on what to do and how to react in such cases. I think that's what I am to share, unless there's a question. Thank you. Over to you, Dr. Lee.
Thank you so much, George. Thank you for sharing with us your experience. I also understand you're sounding like you're overwhelmed. I hope you're able to get some care also. Yes, I hope you're also able to get some support, some form of support and care.
Yes.
Right now, at this moment, the carer also needs care.
Exactly.
So you're able to get some help.
Right.
Before I hand over to Dr. Nancy Ngumbao, there's a comment I've seen which probably maybe applies to a few of us. So Martha is saying, social stigma is so real even in our daily lives. I remember once losing a close relative and being told you can't cry or be seen crying because you're a healthcare worker. We've all lost relatives or loved ones in one way or the other, either as they were receiving care or even before they got to the facility. And your relatives turn to you and they expect you to have control of the situation, yet you're also affected. So Martha and Jerry, I totally understand what you're talking about. Anne is saying we need to remove the sirens. She's asking, why do we need the sirens? And stigma starts with us as healthcare workers. Why do you need ambulances with sirens when picking a patient who has been confirmed to have COVID-19? And I remember this is a question that has come quite a lot about the people with the suits coming to your house. There is police. It's a full battalion coming to pick you. So stigma starts at that point because you see your neighbor does not understand what's going on. And maybe for healthcare workers, because today we are focusing on healthcare workers, and it might be a bit different. I don't know if there's a healthcare worker in this forum who has been on quarantine or has been under isolation who can share the experience. Were you picked from home? Were you given the opportunity to take yourself to the facility? How did your colleagues treat you after this? Once they discovered you went into isolation or into quarantine, how did the management treat you when you went back to your facility, whether it's a private facility or it's a public health facility? So those are some of the things. What kind of support did you receive? How reintegration back into the community when you went back home? How did your family receive you? How did you even share that with your relatives who are not within Nairobi that you are in quarantine? Were you brave enough to share with them that you're under isolation? So those are some of the things that we'd love to hear from healthcare workers. I am hoping we have one or two who will be willing to share with us their experience so that we can be able to learn how to treat each other better before, because the world, as we've seen, can be a bit harsh to the healthcare worker. So how do we treat each other as colleagues better? Dr. Nancy Ngumbao, I'd like to hand over to you to take us through the comments and the Q&A section.
Thank you very much, Dr. Kalondo. It's been a really interesting discussion and good pointers, as most of the comments as we hear is concerning the stigma. All of us are facing the stigma of just working at a hospital or being close to, just the fact that we are working at a hospital, everyone assumes you're close to patients with COVID, even the people who are working at IDUs. I remember a news article where all of them were giving the experience working in the IDUs and them saying that they've had to answer questions from their families concerning like why would you be working there? Do you want to live with us? Should we move? And such things. I'll give a personal experience concerning this stigma. I remember at the beginning of the outbreak, once it was announced that we have a corona case in the country, and KNH will be receiving the corona case. A few days later, I remember all my relatives calling and saying I should now move out to an SQ because at this point in time, I will infect everyone that's around me. So the stigma is real, and I'm sure every one of us has a story to tell. I will allow Alice Wanderi to ask her question. Most of the other questions in the Q&A have been responded to. But unless anyone also has a question, please unmute yourselves and talk. Alice Wanderi. Okay. George Mongera, I can see you want to make a comment.
Yeah, just a comment from just what you've shared. I also had a personal experience on the same. I remember when just the other day when we were waiting for the president to unlock and give us freedom to move. I remember calling home and I was talking to my father and I was telling him that we are looking forward coming over to see you people. And the first thing he told me, please don't come. Just stay there. We are comfortable. Just stay where you are. And I could not believe it. You know, I was looking forward going there. I had also shared with them that I am rotating at Bagadi IDU. I was there. But the voice and the fear he had, that told me I'm not welcomed home. But then I made a quick comment, nikamwambia corona ikiisha na nyinyi msituite. So it was that, you know, bad. So this is an experience, as you are seeing, there's a lot of stigma and also self-stigma. I know I've been with sessions with our colleagues and they were asking why it's like they were sent there to work in the IDUs as a punishment, as a form of punishment. Some of them were even breaking down that because they've been sent there, their supervisors are pushing them there to go and die, which of course is not the case. So there is those even self-stigma which is there, and I believe we are going to address through sensitization. Thank you so much. Yeah. Over to you, Dr.
Thank you very much for sharing that. Anyone else would like to share? There's Joseph Chebon. Mary, kindly unmute yourselves and ask the question. As they are asking the question, there's several questions, several people asking the same question in terms of the daily updates. Now that, given that having corona is now the new normal, is the daily updates fueling the stigma? Is it reducing the stigma? And how else would we be able to avoid some stigma around this disease? That's been asked by Alex Ndungu. Maybe Dr. Gidua, you can respond.
Okay, thank you. Thank you so much, Dr. Gumbau, for that chance. First of all, even before I answer that question, I'd like to say that, Doc, your experience as well as George's experience is so real. And I think that I'd be speaking also for Purity when I say that we've really seen this a lot, you know, where the family is not really that receptive and people are looking at you very differently. And of course, Doc, as you're being told to go and move into an SQ so that you don't infect other people, it's people's lack of knowledge or lack of information around COVID that is really, really fueling some of these reactions. Well, so to Alex's question about the daily briefing, so to me, I think it's a double-edged sword. And what I mean is this, is that on one hand, I think the government's strategy in the beginning was to tell us how we are doing as a country in the sense of the number of people who are getting infected or the cases we are discovering every day, but also not just as a way of just telling us how many people have it, but also to take a chance to talk to us about what are the other steps that are being taken into consideration. For example, the economic stimulus and all the other things. So I think you've said it really rightly that it's our new way of life. And in fact, yesterday someone was asking me in another forum, they said, so Daktari, if you can tell us what is the most significant thing in the world right now, I actually didn't tell them COVID. I said COVID now is like our relative. You know that you can have a relative that lives with you that you don't really like so much, but you have to deal with. That's who COVID has become, because for some reason we will have to live with this pandemic for a long time. And I think people need to start adjusting their way of thinking around that, so that maybe the daily updates won't be the ones. Maybe someone in communications might talk to the government and tell them and tell the top people that maybe you can give a weekly update now. It doesn't have to be daily. Reduce the number of updates. But then what we really require right now is a strategy. It's mostly about the strategy. How are we dealing with the hospital beds? How are we dealing with medication and PPEs for our doctors? How are we taking care of doctors, for example? How are we offering psychosocial support? And can they even talk about forums like this one we have to open it up to other people? So I think you're right that maybe we need to ask the question about, are they necessary? But I also think that because of where we are right now, numbers seem to be the thing that are fueling a lot of the things, including whether to open or to close and all of that. And I think because we have to live with COVID, maybe the tone around what it is what needs to change, so that we don't, the same way we don't go and announce about today we have 15 more people who have been diagnosed with diabetes, and because all of you are eating sugar, you are not disciplined. You understand? So we have to change. Medical questions need to be dealt with in a very delicate kind of manner. Thank you so much.
Thank you very much, Dr. Githua. A question from Frederick Kamau. Are there any psychosocial support that can be offered to an already stigmatized person? So I'm looking at that question in terms of, I've already given my story of how I've been told to move out, or I'm facing stigma even as a healthcare worker. Where do I go? Whom do I call? What do I do?
Okay, thank you for that question, Dr. and even the person who has asked. Let me respond to it. Clearly, there are many places that you can go, but I want us to just look at what we have readily available and accessible to all of us. The other day, I talked about the number, the hotline that one can be able to call, and you'll find a counselor, a trained counselor waiting on the other end to listen to you and to talk to you. And the number is 1199. That's the Kenya Red Cross line, toll-free line that you can call any time of the day or night. It is manned at night, it is manned during the day. So one can call that number. That is now for professional, actually that one is for PFA, psychological first aid, as you get referred where need be, if you still feel you need to talk to someone or you need further support. Then also, I believe in social support, like peer support, where you can just get somebody, your colleague, tell them how you're feeling. Let's say you have been stigmatized. You don't need to wait until when you see a counselor or a psychologist for you to get support. Talk to someone that you can trust. Explain to them how you feel, talk to them about what you have been going through. And just the fact that they are able to listen to you, you will be able to get the help that you need. So you can talk to a professional, you can talk to a peer, you can talk to a family. Support system. Have a support system that is workable for you. And then also identify someone, maybe your colleague or a friend, who can understand, you can trust, they can be able to listen to you, and not necessarily give you any solution, but just listen to you. Above all, remember, you can talk to a professional. You can call the toll line, the toll-free line I have given, 1199, at any given time, and you will get support. Thank you so much. Over to you, Dr.
Before we get back to Dr. Ngumbao, let me also add something from what Purity has said. The 1199 line is really great. I think she's also mentioned talking to a professional as well as social support, which is very, very key. The other one that I want to add is that I know we have this Thursday session, and maybe I'll leave this to the Kenyatta team to talk a bit more about. But what I can say at this point is that at least the teams have already been set up. And on every Tuesday and every Thursday between 10 and 12, there is normally a line open for a different topic that's being addressed with smaller groups of people. Like right now we're over 1,000, but when we're not 1,000, there's even more time to actually talk in a personal kind of a way. And the psychologists who are on the other end of that line normally will also show you another way you can actually get help immediately. Now, if you happen not to be from Kenya, okay, that's the first one. The second one is every department at Kenyatta Hospital, at least right now I know, will have a group that is actually set up departmentally to actually receive help according to their own group. So I know that's also ongoing, and we are happy to really work with you on that. And then finally, I know that that if you need any help, if you speak with the Kenyatta team, they actually get in touch with all of us, all the associations that are working in close proximity of them, the KCPA, the KPA, also the CPAC and all the other people, as well as a group from the NCTC, from the Ministry of Interior. So all of us are working in conjunction, and you have very professional people who are willing to talk to you as a healthcare worker. And the one thing that we have learned is that I don't have to be face-to-face with you in your hospital. Just the way we are reaching each other right now is the way it's going to happen virtually, and we can actually do that at the convenience, even from the convenience of our homes. Thank you so much. Thank you. Over to you, Doc.
Thank you very much, Dr. Gidwa. I have allowed people to unmute themselves and ask their questions, even as we're coming to the end of the session. Jessica Wambani, Joseph, Chebon, Manyara Wilfred, Teresa Mecho.
My name is Dr. Wambani, Jessica. I would just like to make a comment. I think we are developing the stigma ourselves. I think one, as a medical worker, should always express that in the past we've dealt with tuberculosis, very infectious diseases like measles, especially when I was an intern in my years. Measles was killing a lot of children, but we had children ourselves. So we should tell all medical workers that the stigma they face is probably, they should re-examine themselves and see what role have I played to get this to be stigmatized? Because most health workers are heroes in the society, and you should carry yourself as a hero. Even if you're on the front line, you just protect yourself, put on the protective gear, and be a hero. And I think we should encourage each other and talk about it freely, and also encourage each other that we are heroes. We are not people who are timid, who are scared, and so on. And the way we talk to our families, we should not look like we are timid, we are scared, and we refuse to go to work because you might think that you'll be infected and so on. Those are the things that now lead stigma. When you look that you are scared and what, but when you feel that it is your duty to go and work and do your God-given gift to be involved in healing, I think that is just, you're just a hero. Thank you very much.
Thank you very much, Daktari. Manyara, Wilfred, Joseph, Shebon, Miri, or Teresa Mecha? Thank you very much for the session, for the very good input from Dr. Oscar Githua and from Purity McKenna. I think we are all in agreement that healthcare workers right now are facing a lot of challenges in terms of even mental health and stigma from other healthcare workers, from their families, and from just the general view that healthcare workers are having right now. I'd like to give it back to Dr. Oscar Gidua and Purity to make their final comments, even as I hand over the session to Dr. Kalondo.
Thank you very much, Dr. Ngumbao. Purity, do you want to go first? I believe in ladies first.
It's okay, Dr. Just go ahead.
Okay, thank you. I'd like to.
Sorry, Dr. Gidua.
Yes.
Sorry, before I let you make a final comment, I can see Stephen Michel has a burning point, and he's been raising his hand for a while. So Stephen Michel, please go ahead and share your concern with us. Stephen Michel, unmute yourself.
You can hear me now?
Yes, we can. Go ahead.
Thank you for the great presentation. I actually had something to share when you spoke about we share experiences because my son was quarantined, but that aside, because of time, maybe I don't know that this is a forum that I need to ask this, where we admit the psychotic patients who have COVID. Because I think there's a lapse in that area. I don't think we have looked at that issue. So that's my question. The psychotic patients who have COVID.
Okay, thank you so much, Stephen Michel, for your question. That one, maybe I'll need to confirm where those patients have been admitted or where they're being isolated or quarantined. I'm not sure whether Mathare National Referral Hospital is admitting, but I know the few we've encountered have been coming to KNH IDU. But I'll still need to confirm more about that particular concern.
So when they come to our IDU, are they separated or are they put together so that we have what we call patient safety or nurses safety? I mean, that's the question we need to ask as going forward.
I hear you. We will confirm where the patients have been kept, but I know there was one who we had in Pagati was transferred now to KNH itself. And we also had another patient last week in KNH IDU, but we'll need to confirm. But these were persons under investigation. I'm not sure how their results came out. The results, are very confidential, so I don't have access to them. But at that time, there were persons under investigation. So we'll need to confirm and probably ask the team tomorrow that will be sharing their experiences, whether they've encountered a patient of that nature.
Thank you.
Okay. All right. Dr. Gidua, Purity, can go ahead. Sorry for that.
No, thank you. Thank you, Dr. Kalondo. I think that question from Stephen is very important as well. And I think as a country, we need to really think deeply about our patients who might actually have mental disorders and probably who might be psychotic, like he's saying, to be able to take care of their needs, which are unique. And you can imagine if somebody is infectious and they are also psychotic, I think that really needs to be taken into account. I think that's a good question. I wanted to say that for me, I am truly and deeply honored. This is a forum that has really touched my heart, and especially because the number of people who are taking part in this have very many. Today, the number of people were 1,018. And 1,018 families represented here, 1,018 experiences covered here, 1,018 people with various experiences. And I just want to reiterate what I've always been saying when we do this, that the work you do is so important to us. And I think that we will continue to support you. We're really privileged that you actually have us to do this with you. We don't take it for granted. And really do thank you for the service you're offering the country. And if nobody else tells you thank you, just know that for us, even as we are here, this is just our small way of showing you and our thanks and saying that we'll take our professional time to share with you because we are colleagues. And because I like to say that there is no health without mental health, then when you see those of us from the mental health perspective working with you, it's because we understand that today it might be you on the front line, tomorrow it's going to be us on the front line dealing with something different. So just want to really, really, really encourage you and just know that there's somebody there for you to help you. And also that the social support, and we also work at other levels to really try and see if we can actually have more national cohesion to actually create the bedrock of that support that you require. Because also when people are fighting themselves outside in the country, we can't also support you properly. So I just want to tell you, thank you so much from the bottom of our hearts. Thank you so much. Purity.
Thank you, Dr. I also want to just echo what Dr. has said, that we really appreciate this opportunity to be able to reach out to so many people at the same time and offer the support, do what we love doing and what we are called to do. I am deeply grateful that I'm in this platform and to be able to reach out to someone and make some or cause some positive impact even during this very trying season, very challenging season. So I want to encourage all of us, whenever you feel overwhelmed by a situation or what the challenges that we are having as a country and the world at large, please reach out to someone, talk to somebody, talk to a friend, talk to a colleague, reach out to a professional. Do not keep things to you and you get depressed or it gets worse on your side. Please reach out to somebody and you can rest assured there will always be someone waiting to offer you support. Thank you so much, Dr. for having us and everybody else who has supported this meeting. God bless you.
Thank you very much, Dr. Gidua and Purity, for always being there. You started a very good session that is currently ongoing, and we appreciate. There's a comment that I'd love to read for you before we end the session, and this person is saying, it has been a hectic situation. Why? Because I felt like quitting my job till this end. Every day being reminded that you might infect the family was hard, but I decided to stay put. I thank God and all the panelists who have been handling stress. You did me good. I'm more stronger. So Purity, Dr. Gidua, all the panelists who participate in the Mental Health Wednesdays and Thursdays, all the panelists who have been in this forum, you've helped quite a lot of people. And this is one person who's coming back to say thank you. And we appreciate you for coming back to say thank you. And I'm sure the panelists also appreciate you for saying thank you. There are a few questions about where you can get, whether there is support for healthcare workers. As Purity and Dr. Guido have reinforced, yes, there is. The toll-free number is 1199. But also at the same time, you've also been given contacts how to reach them if you need further assistance. There's also the forum that is organized every Tuesday and Thursday for KNH staff, but it's something we're considering opening up to see whether we can also have a few of you who are willing to join. It's a voluntary session that you join in. Pharmacist, Moses, you're asking about pharmacists on the front line in contact within the estates. We understand you very well. It's true, we have quite a lot of pharmacies and chemists within Kenya, and you are the front line. So I hope, Moses, you've been able to pick something from this session and from all the other sessions where we've been talking about the measures that have been put in place and how to protect yourself. I don't know what plan the government has for you, but what we can reinforce is that take good care of yourself at your workplace. And in case things get overwhelming, you always have a system in which to fall back and get support from. Timothy is asking about yesterday home-based care presentation. We will upload it on the KNH website. When you go to the KNH website, you will find all the sessions that we have had from the beginning. They're under the COVID-19 folder. Up there, you'll see the COVID-19 folder, webinars and presentations. You'll see, when you open that folder, you see COVID-19 presentation, COVID-19 articles, COVID-19 videos, COVID-19 audio. So under COVID-19 videos, you'll find all the videos and presentations that have been made where we've been given permission by the presenters to put it up. And you'll also find the presentations under the COVID-19 presentation, the slides. We've not yet uploaded the one for home-based care. It's still being edited by our ICT team, but you will find it there. Give it a day or two, you will find it there. So Timothy, you will find that there, and I hope it will be able to help you. So thank you very much for listening. Thank you so much for participating in this session. We can see The more we participate in these mental health sessions, the less our anxiety is. From the comment section and from the Q&A, we are seeing less anxiety in our statements and in our comments and in our questions. So we appreciate that, and we really hope they've been very helpful to you. We'd appreciate any feedback that you have. You can send it to knetresearch@gmail.com. How can we make Mental Health Thursdays better? Is there a topic that you feel has not been addressed? This is, I believe for most of us, this is the only opportunity we've had where we've gotten something close to therapy. If for me, this is therapy, but for others, maybe it's something close to therapy. So if there's a topic that you feel Mental Health Thursdays has not addressed, please send us an email on knetresearch@gmail.com and we'll be able to address it. Next week, we'll be addressing the health worker well-being and mental health and burnout. So we'll be comparing we'll be having a discussion with team from the United States of America and comparing it to the Kenyan perspective and the picture that we're seeing on the ground. Thank you very much for attending this session. Thank you so much, Dr. Gidhua, Purity McKenna, and George Mongera, and everybody else who called in to share their views and sentiments and concerns, and also to ask a question. Thank you very much. Dr. Nancy Ngumbao, thank you very much for being my co-host. I truly appreciate that. Now, tomorrow we have 2 sessions. Tomorrow is Friday. This Friday seems to be getting here very soon, but tomorrow we have 2 sessions. The experience sharing, managing COVID-19 disease. We also appreciate your feedback on that. How would you like us to make it better? Last week, we got feedback that from one of the participants that we need to make it more participatory than a lecture format. So we'd love your feedback at knetresearch@gmail.com. Please give us your feedback on how you'd love the experience sharing session to be made better and to be able to address the Kenyan picture, not just the Nairobi picture. In the afternoon, we are hoping to have a team from the Ministry of Health to take us through guidelines on resumption of routine clinical duties. We all recently saw the circular from the Ministry of Health that we need to resume our elective surgeries. So we'd love to hear from them. How would they like us to approach this? How would they like us to go back as you open up your theaters, as you open up your clinics, if you've not been offering any care? As you start and rethink about reopening up, what guidelines should we put in place? So we really hope to have that team on board, and we'll have that discussion tomorrow afternoon. Thank you all again very much for listening, and have a good afternoon. Bye.